Special Hospital Sveti has received a special award for posterior segment surgery. What's it about? What is posterior segment surgery? You see, it's a very complex field of ophthalmology which comprises retina and vitreous body surgery. Problems are numerous here, starting with common retinal detachments, through diabetic problems and fundus changes in diabetes, then various traumas, processes in the macula, the yellow spot, and many other problems. What is retinal detachment? Retinal detachment is the separation, ablation of the retina from its foundation, and the retina is a functional part of the eye. It is in fact a part of the nervous system, and that's why we often say that vitreoretinal surgery is a type of neurosurgery of the eye. What does retinal detachment mean for the patient? Practically, if not treated, this means definite loss of vision, blindness. How can it be recognized? What's happening in such cases? This is a very important moment because the patient should react to the first symptoms. They seem rather unsuspecting, and due to this, precious time, meaning the time when surgery has to be performed, may be lost. The onset is most often felt like sudden lightning or flashes, which need not always mean retinal detachment, but they mean an ophthalmologist must be seen. Why? What does it mean? At that moment, it means that something has stimulated the retina, the vitreous body. In most cases, the vitreous body, in such a normal physiological thickening process, tracks the retina, which is behind the vitreous body, and may cause a rupture in the retina. At that spot, retinal detachment will start. What can we do at the very first moment when a rupture is noticed? We can use laser photocoagulation to make a barrage around the rupture and thus prevent ablation or complete retinal detachment. If retinal detachment has already occurred, how can it be recognized? The patient usually notices a curtain that sometimes occurs in the lower part of the eye, meaning in one half of the visual field, because in most cases retinal detachment begins in the upper retinal area, which is projected as a reverse picture. At that moment, it's urgent to see an ophthalmologist, and this situation requires urgent surgery, and our task is to return the separated retina to its foundation by a surgical procedure. How is this performed? It may be performed in two manners. Classical surgery can be applied with circlage and filling, but this means without entering the interior of the eye. However, if the patients are persons with high myopia, which is frequently the case, then vitrectomy must be performed. This is a more comprehensive surgical procedure that requires the vitreous body cleaning and tamponade, which may be gas tamponade or silicone oil tamponade, and of course the application of endolaser, which means the application of laser during surgery. It's this vitreoretinal surgery that has reached its maximum possibilities through an evolutionary development here in Sveti. It's become small incision surgery without stitches, like anterior segment surgery. It's provided the patients with a possibility of very comfortable surgery with a complete solution to the problem. It's a presentation of this that won the highest award at a congress 2 years ago. What kind of help may be provided to diabetic patients? Well, you see, if we talk about an ophthalmologic approach, there are two possibilities that we expect here. These are cataract that may occur in diabetes, the so-called metabolic cataract, and changes in the posterior segment in the retina and vitreous body. Good monitoring is essential, comprising diagnostics that will discover any initial changes which in these initial stages may still be solved by laser. This means laser photocoagulation as an outpatient procedure. This is very important for two reasons. First, because you keep the condition under control and postpone vitrectomy for several years. At the moment when surgery becomes necessary in several years, it will be much simpler as the condition is secured. Therefore, the situation will be under control if the laser procedure is performed timely. If we talk about surgery, about vitreoretinal surgery in diabetes, it must also be done timely. When is the right time? What most often happens in these patients are hemorrhages, extravasations, exudations in the vitreous body, and the patient feels these as vision blur that can't be corrected with glasses. In repeated hemorrhages, it's better to perform surgery immediately and repair the process, as during the surgical procedure, laser is applied before retinal detachment, before the retina is completely separated from the vitreous body. Such patients, treated timely, have the best prognosis in terms of visual function. They return to their normal daily activities, to their professions, and their vision lasts indeed, provided that, of course, the further regulation of their main disease, blood glucose, is adequate. Unfortunately, such a situation is rare. This should become a rule in our country, but this is something that we rarely encounter. We most often encounter something that mustn't exist, and these are patients in totally neglected terminal stages of diabetes where no laser has ever been performed, and such persons usually come with a little vision, minimum vision in the last eye. What does it mean? It means that the chance has been wasted to timely perform laser in that first eye when changes occurred, or to timely perform surgery and it's a lost case. Such an eye usually becomes blind, and then, frightened by the situation in the first eye, patients come afraid and delay the operation in order to use their vision as much as possible. They wait and waste time until they see their vision in the last eye becomes also impaired. We're then in a very awkward position, as we practically have a patient with 10% visual function, which means 200% visual function to him. Therefore, the mere start of the procedure is unsatisfactory. This is a case of inadequately corrected blood glucose, of omitted laser procedures, of an eye full of blood, with very poor blood vessels. This is the so-called neovascularization, very often with a late permanent terminal complication called neovascular glaucoma. A damning fact in our country is that, I may say it clearly now, 80% of patients appear in this stage. In such cases, surgery has a longer course and several surgical procedures are required to repair the condition. And the repair can't be very satisfactory, as the main problem here is the omission to act on the ischemic factor. Therefore, we have a very bad situation, and whatever we do, regardless of achieving the vitreous body cleaning and the attachment of the retina, will have no healthy blood vessels to further nourish the retina.
Kada postignemo čišćenje staklastog tela, naleganje mrežnjače, mi nemamo više zdravih krvnih sudova koji će dalje ishranjivati mrežnjaču.